call to order the March 28th, 2014 meeting of the Health and Human Services. We look at the agenda. Anybody have any questions about the agenda? Additions, subtractions? If not, do I hear a motion that we approve them as presented?
Motion.
Move. Second.
Second.
All those in favor say aye.
Aye.
So be it. In accordance with the State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and appearance. The minutes of the last meeting we have received by the internet. Any questions, additions, or subtractions? Do I hear a motion that we accept them as presented?
So moved.
Move, second.
Second.
Move, second. Any questions? All those in favor say aye.
Aye.
Be it. Good news. Lisa.
So, a while ago back, actually last spring, we showed you guys a video on Tip and Toss that had, Krista, can we cue up the, no, is it right here? It was a campaign that we did. It was actually when the communication team was just beginning to form. So we had people coming together with a variety of skills, but it really all came together beautifully. Galen Ehrlichman wrote the script for the video that we did. Ben Atkins did the supporting graphics and posters. I'm sure Jennifer, because we work in a team process, probably had her hand in that as well. And who am I forgetting? Rashida. Where is Rashida's not here? That's why.
She's sick.
Okay. Rashida's not feeling well, but we used the children at Pisgah View Apartments, the Girl Scout troop there, and created that video that you saw was the Fight the Bike. Does everybody remember the video? Mm-hmm. Well, it got first place in public service announcements. And it's for excellence in communication, and we obviously did that in partnership with the Buncombe County PR department as well. Cataldo, and it was actually Max that did the filming of that, and he did a great job. But it just shows a wonderful partnership internally, but it also shows just that the work that we're doing along communication is being recognized at a national level. And I was very proud of the video. I don't know if you don't need to see it again, but it is a really sweet, sweet video. So we'll use it again this spring as we roll out the new Tip and Toss campaign as well. So any questions? Or I just like to make sure that team members get recognized. Y'all want to stand up? So it's Ben Atkins, Galen Ehrlichman. Stacy Wood has now joined our team, and so I expect great things from her, and Jennifer Johnson over there.
Video sure does tell the story.
It does, and
And thank you so much.
those kids are so stinking cute.
It's wonderful. Thank you. We'll now hear the FY14 budget update. Jim?
Yeah, good afternoon. I'll switch here and so we're now 66 2/3 of the way through the current fiscal year, and we'll take a look at DSS expenditures by area and by accounting unit. And as you'll see, where we could be at 66 2/3%, we're tracking right on target with our major expenditures of salary, operating, and human services assistance. When you look at contracts and capital, remember those are recurring items that we've talked about. Contracts are those contracts that we have to pay in advance because those are benefits that are being issued on our behalf, and so we're upfronting the money for organizations to be able to provide those. And that capital expenditure was a result of a coding accounting unit coding back several months ago. It's been the recurring item that's been on there. That's about $2,400. Looks big because it's 100%, but it's 100% of what was in the budget for expenditures. Everything else is on track. We anticipate, again, we're doing projections month by month and sending those, looking at those internally as well as providing those to the county, and we anticipate to be within our budget for FY14. Yes, sir.
What about the ones like child care enforcement that is significantly lower?
So,
Child support enforcement, I'm
yes.
sorry.
The reason for that is because we had budgeted for some space as well as for some anticipated court costs that we've not had to expend. So that's been a good thing. In our contract also, we renegotiated our contract with our provider for a lower rate, and that was done after the budget had already been posted July 1. So.
Jim makes a good point about child support, and I want to say that because clerks in North Carolina, under a change in statute, had the option of charging local DSSs for filing in child support cases, and our clerk opted not to do that. We had the budget anticipating we would assume those costs, and we opted not to do that, for which we are very grateful. Understanding that's money you want to go to the children.
Other questions? Okay, well, we'll take a look now at the public health budget. 66 2/3% of the way through the health budget. As you'll see there, we're also well under that target range, with the exception of the capital expenditures, and that was the main thing. You'll see, to answer the same question that you raised earlier, Don, the contract expenditures are based on what we anticipate we might need in terms of contracted services. If we don't need those, we don't expend those funds. I'm happy to answer any other questions that you might have about the financials. Okay, if I may, Mr. Chair, the next item on the agenda?
Yes, the FY15.
Well, we have an amended.
Oh, we have the amendment.
The amended item on the budget, on the agenda, related to our child care subsidy agreement that the board authorizes us to operate under our child care subsidy program. As you may remember, the board is charged with making sure that the policies and procedures that we have for our child care subsidy program, you approve those. And we're, of course, under the state oversight. One of the areas where we have found is that within child care subsidy, particularly with both the economy and with the implementation of the Affordable Care Act, employers are reducing hours for their employees. We've set the threshold to be eligible for child care subsidy at 30 hours per week. We're finding that we've now looked at a wait list. We've had a wait list for a while. We were able to work through that wait list, and we don't have a wait list anymore. And because a lot of those folks were not eligible based on the criteria that we had established. So we're proposing to lower the threshold, as long as we do not have a wait list, for the amount of hours that a family or a parent can work to 25 hours. That's more in line with what's happening across employers as a result of the economy and the Affordable Care Act change. That will allow us to provide more assistance to folks who need child care subsidy because they are still working, but they weren't able to meet that 30-hour threshold. And so we're asking you to approve that change and to make that effective, and that would be what the board action that we're asking you to take today. And I'm happy to answer any questions that you might have about that.
I think it's good. I'm wondering, is that going to create now a wait list? Is that going to put us back where we were before?
Great point. If it does create a wait list, we go back to 30 hours.
Okay.
So
One
this
of
is,
the challenges about child care subsidy is if you don't spend the money, you revert it and they reallocate it to other counties, so you really have to keep your spending coefficient above 100%. So that's what we're attempting to, and I think at least Dr. Oliver got lobbied by a child care provider. In addition to children, I will tell you, this subsidy situation has put several child care centers at risk of closure because of the having less resources coming in as a result of the subsidy.
So do you need a motion?
yes, we do.
I move that we reduce the hour requirement, employment hour requirement from 30 to 25 hours. Is that right?
Yes, as long as there is no wait list.
Well, I'll give you some flexibility on that. You can come back to us if it creates a wait list.
Will you include it or not?
I'm not including it. I'm giving you permission with this motion to have a wait list because I don't think you'll know until you do it how many people are going to come forward. So I wouldn't want to lock you in with it 25 and no wait list, because then if you did the other, you'd be out of compliance, so I don't want to put the wait list
I
in
do
there.
think what Dr. Locke's describing is how the revision is written to allow flexibility
Yeah.
based on
Yeah.
anyone.
So my motion is to reduce it from 30 to 25 hours, period.
Dr. Hall, would you like to second that?
I would,
Okay. I figured you were all excited about it.
yeah.
Any questions, any interpretation needed?
This subsidy can be used at any, the parent can use it at any daycare, right? I mean, it's not just specific.
The policy they have to be enrolled in the subsidy program, and subsidy in North Carolina now can only be used, am I right, Trish, 4- and 5-star programs in terms of quality, it requires parent choice. You
Okay.
choose which center.
Any other questions? All those in favor say aye.
Aye.
Opposed, same sign. Passes. Thank you very much.
Question. So does this become, in effect now, or does it have to go to the commissioners for approval?
No, this board is the policy maker.
Okay, got it, thank you.
And I would say that Philip's been working, so that it hits the ground running within moments of him sending a text.
Thanks, Bill.
Okay, so you ready to go to the FY15?
I am.
We're very fortunate in the fact that we have an opportunity as a board to listen to the budget situation at every meeting. And what we need to do is listen to this particular FY15 and endorse it, hopefully, so that the Board of Commissioners can eventually approve it. But it is a requirement of this board to endorse, not to make the approval of the budget. But we have been involved with it quite a bit, and I know that the Board of Commissioners will be extremely happy to know that there has the support of this board.
Thank you, Mr. Chairman. So it's with pleasure that we present to you the proposal for the FY15 budget for Health and Human Services. Just as a reminder of the process that we go through in establishing what the budget is done, it is a budget that's derived from the folks that actually implement the programs. So the planner evaluators work with the staff in establishing what the priorities are that meet the mandates, policies, statutes of their particular program. We then cost those priorities out, and based on the funding that we have available, we look to those and see are we able to fund those. We look across Health and Human Services, and if something has a greater priority based on law, policy, or statute, that particular funding goes forward, and we look from a negotiated standpoint to make sure that we fulfill all of our mandates that we have in our budget. The things that we all follow are federal statutes, state statutes, administrative rules, and commission directives. Those are our guiding principles in terms of what we do. And if you've been any time on this board, you know that that's what we focus on. We believe in focusing on our core services and those things that we are uniquely designed to do and that no one else can do. And even some of the core services that we're mandated to provide, if we can find a contractor that can provide the same level or higher level of services, then we will engage that contractor so that we can again focus on those services that only we can provide, such as income maintenance, that only by federal statute, federal law, can we provide eligibility determination. In North Carolina, only we can provide child protective and adult protective services. So we work very diligently to assure that together with partners and as a department that we do those things that are outlined by law, policy, statute, or commission directive. As with any budget, there are funding pressures. And so I wanted to outline for you some of those funding pressures that we've been faced with, both from an ongoing perspective and from a prior perspective, and some things that are on the horizon. Well, thank you.
Yes, thank you.
Thank you.
Pay for y'all.
That's good.
That helps me too. So some of the funding pressures that we've seen has been at the federal level, has been federal sequestration. That has impacted particularly, well, both public health and DSS, but it's impacted us in a particularly substantial way with our social services block grant funding. That is federal money that the feds give as a block grant, and they have not increased that block grant funding in my memory. That funding has stayed the same, but now with federal sequestration, we have seen reductions in that funding. That funding is the only funding that we have other than county dollars to support adult protective services. It also helps to support some of our child welfare services. We never have enough money to do that because it's a block grant that hasn't changed and has actually been reduced from well over 15, 20 years. So that impact is a definite pressure on us. The temporary assistance for needy families, or the TANF funding, that's also federal funding. That funding has been sort of a seesaw, a roller coaster over the years. That actually goes back to 1996 with President Clinton and welfare reform. They established a federal block grant for TANF, and that money has been the same since 1996. Unfortunately, the resources needed to implement the programs that that's to support has not remained the same since 1996. But we've also felt pressures to reduce that, and we actually have reductions in that. The state has tried to help us in finding additional funds to help backfill some of those cuts, but they have not been enough, and they have not been able to be sustained over the long term. The Community Transformation Grant. Community Transformation Grant is a regional initiative that funding came from Centers for Disease Control and Prevention, and that grant was designed out of the Affordable Care Act to help look regions, counties, states to improve the health of the community, to reduce health disparities, as well as to actually save costs in the healthcare system. We are now in the second year of that grant, but when Congress approved the budget in January, they specifically took that money and that program out of the Affordable Care Act to use to fund other initiatives within the Affordable Care Act to improve enrollment. So that funding has ended, and we have enough funding to last us until September, but the reality is the program is gone. Public health in general has faced reductions in terms of sequestration in particular. We've seen that in our family planning program. We've seen that in potentially in our BSEP, breast and cervical cancer control program, and we continue to see that flat funding to be able to support what we're doing. Now, you'll see some very interesting and somewhat disturbing information later on about how that's translated into our budget, because those are still things that public health must either directly provide or assure are provided in the community. Domestic violence. Now, domestic violence is not something that is a core service of Health and Human Services. We do not provide domestic violence support as part of Health and Human Services. But the funding pressures that have been placed by reductions at the federal level for domestic violence initiatives has significant impact on Health and Human Services, particularly in the area of child welfare, because a lot of child welfare cases stem from an issue of domestic violence. And we are working diligently with our partners in the community and some initiatives that you'll see later on to try to address that so that we can reduce the incidence of child abuse and neglect, and hopefully keep families intact and reduce the incidence of domestic violence long term, and to protect the victims of domestic violence as well. One of the biggest ones is NC Fast. NC Fast has been you've heard this a lot, the transformational change in Health and Human Services. And it has had a big impact on counties. And the funding pressures you'll see in just a minute of what those pressures look like. This year, just this year, end of last year and through this year, NC Fast, we've spent about $2 million in technology, infrastructure, and supports. Most of that, all of that, unbudgeted, to be able to meet the needs of NC Fast for our County Department of Social Services, to be able to implement that program and ensure that benefits get to the recipients timely. The commissioners were very gracious to us in allotting us 17 additional income maintenance positions along with the funding to support that. That's been a tremendous help, and Philip has just now been able to get those positions filled and is seeing the benefits of that initiative of being able to have those positions available to support the work of NC Fast. Salary equalization across income maintenance. In the legacy system was a very siloed system. It didn't make a whole lot of sense to have an income maintenance caseworker doing work in different silos because there was so much knowledge required in order to do that program. With the NC Fast environment, the NC Fast environment looks at the whole family and looks at the person as an entire case, whether that's for food assistance and family Medicaid or food assistance and adult Medicaid. It looks at that family together. So the design has been that we are now looking at a more universal type worker to be able to do all programs within the NC Fast environment. In our old system, we had tiered levels of pay. So people that did adult Medicaid were, because of the complexity of that program, were paid at a slightly higher rate than income maintenance caseworkers that did only food assistance or did only family Medicaid. In this new environment, we've now equalized the pay across all of the income maintenance staff with the exception of long-term care. They're their own separate classification under the State Office of Personnel. So, but we've now equalized the playing field. So we now have staff that do food assistance and family Medicaid and food assistance and adult Medicaid. So that playing field is now level. And so we had to equalize the salaries to make sure that we compensated people appropriately. Good thing, with additional funding as well to support that, we added 4 nurse-family partnership positions. And as you've heard multiple times, the nurse-family partnership helps those first-time moms make sure that they get established and provide the care that they need for their children, and is an evidence-based program that has shown that it reduces the incidence of child abuse and neglect. It reduces the likelihood that the children will become involved in the criminal justice system as well. And it's been a very successful program. And we secured, Gibby and her staff secured additional funding for 4 positions, 3 nurses plus a support person, in order to increase the numbers of people that we serve. Another good thing has been COLAs. Per the county ordinance, whatever the cost of living is at the end of December, that cost of living adjustment is given to county employees beginning April 1st. The commissioners did approve, going back in 2011 when we were in the midst of our economic crisis, they postponed that COLA. And this year, the commissioners voted, and we're very grateful for that, to reinstate that COLA. So we've essentially had a 1.5% COLA, and then by policy, the 1.5% COLA that begins April 1st. So as you'll see in some additional slides here, all of these together has meant a growing dependence on county funding. When you keep block grant funding the same or reduced, and you see the increases based on unfunded mandates that come to us, the growing dependence on county funding is growing. Well, what's on the horizon? Well, unfortunately, there are pressures on the horizon, and one of those involves 4E. Title 4E funding is what we use to support our child welfare workers who work with families with the children that are in the home to help keep that family intact and to try to provide services that prevent the removal of that child from the home. It helps the family, it certainly helps the child, and it also prevents the child from entering the foster care system, which is a very expensive system to enter. It's been very successful. As we've talked a year ago, the state of North Carolina had an audit that they asked the federal government to come in and audit, and they found that we were not following federal policy. We adapted our budget to do that, to handle that. That was about $1.5 million impact in loss of funding as a result last year.
We being North Carolina.
Yes, North Carolina, not just Buncombe. Yeah. Yes, not just we.
Some of us worry about that.
Now there is still discussion about from a federal level about North Carolina's use of 4E funding for particular practice in in-home services, and that may have a direct impact again on the type of services that we deliver, and could mean a big reduction in the funding, and not only funding, but in our practice of the way we handle those cases, which could mean that we'll see more children entering the foster care system.
But,
Yes,
is that coming from the state or the Fed?
that's the federal, that's the federal. Their interpretation of Title 40, when they write the rules.
Tell me what 4E is. That's probably a part of some bigger legislative package.
I believe it's a part of the Social Security Act.
Social
It's a
Security.
Title 4E of the Social Security Act.
It has significant practice implications, which Katie's done to make sure it gets said, because it's really beginning to say it can only be used for children at imminent risk of foster care, and they're beginning to even kind of narrow the timeline. They're tying imminent risk to timeline, meaning if you can't say the child's at risk in a month, 2 months, then you can't draw down 4E. And many of the cases that you deal with in Child Protective Services in-home are substance abuse cases, complex mental health issues, family dynamics, where we historically might have served those families a year and drawn down money while we were serving them. What it will do in North Carolina is drive children into foster care, because at that arbitrary day, we're either going to close the case and provide no involuntary service or remove the child. That makes no sense on any level. Is that a good enough description, Kathy? She feels passionate about this.
Rebasing of allocations. What that means is that the state has looked at a way to equitably distribute the funding that comes to them from the federal government. Right now, most of those in the DSS world are distributed based on census. In the public health world, they're based on a number of complex services, mainly about how many services you deliver of that particular type of funding that you get. Now North Carolina is looking at saying, instead of looking at census for saying how much money a county gets, they're wanting to look at poverty as the indicator of how they distribute money. So the higher the poverty level in that particular county, the more money that goes. That sounds pretty good when you hear that, and you think, okay, well, Health and Human Services, more poverty, they need more services, more dollars, that makes sense. The reality of it is, however, is that our services are not all based on whether or not someone is at or below the federal poverty level. Child welfare knows no distinction on income. We don't just serve families that are at or under the poverty level. Adult Protective Services doesn't do that either. Poverty has a significant impact on both of those services, but that in itself is not a determining factor of who gets our services. So if that funding gets based solely on poverty, then we're sure to suffer as a result of that, because that block grant funding is going to be reduced, and it's going to go to counties that may have a higher rate of poverty, but they may not have a higher rate of adult or child protective services issues.
And that is a state decision, Commissioner King. That's one of those things you can't advocate.
Is that a legislative decision or is that a departmental
It's a
decision?
departmental decision, but one that the legislature would have to ultimately approve as a part of the budgeting process.
You know, and we need to have those, so I will work on.
Yes, I would
Legislation.
appreciate that. Absolutely.
But
We'll give
I
you the
need to
detail
have the
on that.
information.
Thank you. We'll get you the detail.
Certainly a big pressure. These are not all inclusive. So is NC-FAST and contractors. And what we mean by that is, as you know, as I just said earlier, if there's someone that can provide the same level of service as good or better than we can, and that serves that population, we want to contract with those. Well, we do that with Child Care Subsidy, the Southwestern Child Development Commission. We do that with our emergency assistance programs with Evelyn Charities, and we do that with our crisis intervention program with ABCCM, Swananoa Valley, and Evelyn. If NC-FAST is not written and does not allow outside contractors to work in that system, and only requires and only allows DSS employed workers, merited employed workers, to work in that system, which that's very much up for discussion and debate, then that means that all those services have to come back to us. That's a huge funding implication because everybody that we contract with now agrees to accept the funding that comes from the federal or state government to run those services. When we ran child care subsidy, it was costing us about $385,000 in indirect costs to support that. Now, you say that's indirect cost, you don't count that. Well, what happens is that indirect cost gets attributed to that program, and those dollars can't be reimbursed by any other program. So we lost $385,000 because the amount of money that we get is about $300,000, $310,000. It costs us more than that to provide that service. So we will lose, and if we have to bring all those emergency assistance programs back, it will be even more significant because we don't have enough, well, we don't have enough space for one thing, we don't have enough staff, and we don't have enough dollars to support that service. And that's a big deal.
That's
And
on the table now.
it is on the
That's
table.
another area where both board and individual advocacy, not many DSSs in North Carolina contract out to the extent we do. So in some ways, we're advocating on our own with a couple of other urbans. But if you look at child support, if you look at all the things we contract out, we're, and Philip, you may know this better, and or Jim, it's probably easily 100 positions we'd be talking about coming back in. And there's no reason for it. Those contractors operate under performance-based contracts. We believe they do as well or a better job than we did, or we wouldn't contract with them. You know, it's easier for an individual. I'll tell you, in some of our worst NC Fast days, if we'd gone back to the days that LEAC and crisis intervention people were coming in our lobby, we'd have had people circle 5 blocks downtown. It's easier for them to go to Evelyn or ABCCM and not come uptown to us. That's when we really do need help.
Well,
And
is
it
this-
makes no sense.
Is this mutually exclusive? I mean, are they gonna say you have to operate this way, and that's it?
What they're gonna do is, they're gonna say that, they're not gonna allow you to bridge, and then they're gonna say that I can only authorize merited government employees to have access to the system, and those aren't my employees, they're the CCMs or it's a huge.
It's a big deal.
They've
And
got
all the
a word,
things
they got
the
a term
state
for that
should
in the
worry
Army,
about
you know,
is
where-
getting in.
a Charlie Foxtrot or something like that. So,
It has huge implications for Buncombe in particular. This one really does.
I mean, are we talking about looking at having to redo everything potentially?
It wouldn't be, I mean, if they stay to the hard and fast rule, that those outside agencies can't have access into NC Fast, we'd have to bring them in as full-time merited government employees.
Do they have access now?
They have access to our systems, that really aren't in NC Fast.
Not in
Those
NC
layers
Fast
are not
yet.
in, you know, in NC Fast, we're only as far as food we get in Medicaid, but,
They have access to the state systems now.
yeah, like child support
But
does.
the difference being that, and this is kind of where the rub comes, those state systems are all siloed right now. Meaning that if I'm doing energy, all I have access is to an energy system, and an NC Fast system is an integrated case management system that spans many programs, and that's kind of where the rub's been.
And it's the intent that NC Fast be that way, so everybody has access to the same income and asset information, and it improves program integrity. That makes sense. Good intentions. But saying you can't contract it makes no sense. So we're happy to prepare letters if the board, we'll definitely give Commissioner King some background information, but if the board wants to advocate on any of those issues, it's very significant.
So is there any stabilizing of this NC Fast aid? Because I had lunch with Speaker Till Saturday and was complaining about this to him. And,
You know, I would tell you that, and y'all know Trish Wallen and I was gonna introduce Philip, Bill asked me if we'd introduce him, I thought we had another meeting, but Philip Harden is Economic Service Director. I think I did introduce you in another meeting, but he came to us He was ours, grew up here, worked for the state as a consultant, and was the director in McDowell County, and he's our economic service director. So, he or Trish might wanna jump in. I think we would say we can process food cases in NC Fast. It takes conservatively twice as long as it took in the old system to do that at this point.
Is that gonna be the norm, or?
So it's not.
Prior to July 15th, when they brought the first phase of Medicaid on, food assistance was moving along pretty smoothly. And when they brought the first piece of the Medicaid world into NC Fast, then we started having considerable more problems with the food assistance piece again. And although we've recovered to some degree, not back to our pre-July 15th timeframe, and we're having significant challenges still. And they have now slowed down the process of Medicaid going in, but they've been a little delayed in getting us some information that's maybe a little more challenging than what it seemed like it would have had to have been. But speaking to the energy piece and the contract piece, we were in a conference earlier this week, and they told us they're hoping to have that ready by November, December of 2015 to actually have those pieces in there.
We did recently identify, the Western directors, 3 to 6 priorities to be fixed in the NC Fast system, which I'm happy to share with you. If you can share those with leadership, that would be awesome.
I'd be happy to.
Would it be of value if we voice that as a
It
group?
would be very
I think we ought to
Very
look into
valuable.
doing that. I don't know what the process would be, but I think we need to say that we've had such good experience with contracts and with the people in our community who are closer to, if you will, who is nearby
And we've always believed that was about building a sustainable community. The
Yeah.
only strong human service organization doesn't need to be us. We need it to be in faith-based and non-faith-based and nonprofits and for-profits. So that'd be very helpful. We're happy to draft something.
And then we all could sign it.
Yeah, that would be
That'd
great.
be very good.
Yeah, I think, Mr. Chair, I'd like to recommend that we do that.
Recommend that we develop an endorsement.
Yes, absolutely.
Any second to it?
I'll second.
Second.
Yeah, love the seconds.
The whole crowd second. Any questions? All those in favor say aye.
Aye.
I'll be glad to sign. One of the things, Jim or Mandy, when you're looking for support, how many of the counties in the state are in the same situation Buncombe is? When it comes to having this form of money?
There are not as many that contract out, as Mandy said, the emergency assistance programs. I think there are a lot that have looked to us to try to be able to do that.
There are a lot who have tried
Yes.
and are moving in that direction. We probably had 30 counties visit us about a lot of those models.
I think counties see that as a way to help them focus on those things that they've got to do and engage in partnerships to be able to get those done in the community, so.
So when are you gonna know if they're gonna come down and say, you have to do this?
I think Trish was saying, they're saying they hope they have it in place by 15. They have yet to even indicate to us they're agreeing it's a part of, what do they call it, the NC Fast functionality, or much like we also have a document management system, Northwoods, which would be a good point to make in this letter, as do 40 counties, 45 other counties have a separate document imaging system. And NC Fast really doesn't have an indexing for that built within it, but they're not yet even committing that those two systems, that NC Fast will interface with those systems. And bottom line, what that means to Tricia's folks is they're going to enter data into systems so that we're all automated. It's just, let's be honest, the state spent $95 million on this system.
Well, we need to get that off. It's one thing to mandate, that we have to do something without the dollars, but it's another thing to mandate how we have to do it.
And we could tell you, and those of you who work out in the community have heard it, we could tell you stories all day long about how citizens are impacted by either delayed benefits or the fact that from the time we enter it in NC Fast, there's 48 hours before it shows up in NC Tracks. So we're seeing everyday examples where surgery's being postponed, healthcare, people can't access prescriptions. I mean, those are daily stories we're working around and working with partners like, yep, we can't fix surgery, but to address things like prescriptions, that's happening all over North Carolina. So we've approved you. We know you're eligible for Medicaid, but you go to Mission, they pull you up, and it shows you you're not eligible for Medicaid.
That's not good.
No.
We are upset about this.
We're with you. It's real people who are impacted by all this.
We should take those politicians and put them in their shoe for a day. See what they feel like.
Actually, this sounds like bureaucrats.
Well,
We should take the bureaucrats and put them in their shoe for a day and
Yeah,
have
if
them
I-
live like they.
I would say that the messaging of this sits more with the Department of Health and Human Services than the General Assembly. That'd be my honest opinion. Where what we continually hear from them is there are no problems. And there clearly are problems.
Yes, sir.
I was just gonna add that even if they do integrate a portal in which we can still contract the services out, from what we've seen so far with a contractor interface, which we do have for Work First eligibility services, it still causes a lot of inefficiency in what our workers have to do. So they may even, if they do provide a portal, which we're hoping for us to be able to contract out, it still may increase the time it takes to complete work, because we might have to go in and do a step to approve it. So since all of this shared evidence between programs within the system.
And you really have to wonder if the partners that we have, if they have the same challenges in working in this system that we had, will they continue to want to partner with us?
Seriously, Trish,
The
you
contractors.
question your employment over Jim, the slide came up for NC Fast, and I don't know if Philip knows it or not, but Philip goes, just when the NC Fast words come up, that's kind of our world. Cover your head.
It is an all-encompassing world. It is an all-encompassing world for us. Great discussion. So the HHS proposed budget for FY15. Now this, as you'll see, is not the actual full budget that HHS has control over, but this is what the county, we're asking the county to actually write the checks for. So we're asking the county to write checks totaling $86 million for FY15, and we anticipate to get $41,300,000 back for a total county impact of $44.8 million. I'd just like to go through these because we haven't talked about all of these and we don't talk about them much, but they're included in Health and Human Services. Social Services will go into in-depth in Public Health. Valley Child Care contract. As you remember, if you remember being part of this board, we used to have a child care services department, and we actually ran child care centers, as well as provided information and referral support for Buncombe County child care providers, and also in coordination with the regional effort. Because that was not our core function to do, we worked with partners to try to transition those child care centers to other providers, and we successfully did that with Irene Wortham and with AB Tech. We still have a child care center that we were operating at Valley Child Care in Swannanoa at, I can't remember the school now. Community High School, thank you. Where the primary target population were, and it was from all over the county, were teen moms that needed to have child care and were at that high school in order to be able to graduate. It's a great program to be able to prevent dropouts by having them have their children right where they were going to school. It also provided a great mechanism for us, particularly in child welfare, to be able to have an emergency place for children to go that we were either working with their families or the children that we had in our care to be able to have a child care center to be able to go to. So it's a great support of the core services of Health and Human Services. But still, we did not believe that we were the ones that needed to be providing that service. So we issued an RFP last October, August, September, October, for a provider. Southwestern Child Development Commission, who also operates, not only do they do child care subsidy administration, they also operate numerous child care centers in the western part of the state. They bid on the program. They began operating the program in January of this year. They maintained the 5-star rating. They will, we now contract with them for that service. So that $207,000, we're still getting the same level of service that we had, but we're able to save some money as a result of that. And so that's what that represents in child care. And that's also providing us with the ability to serve our core population. Community contracts, that money primarily, the largest portion of that is our contract with Western North Carolina Community Health Services for our adult and child primary care. We now just, commissioners just recently approved an addendum to the lease with option of purchase for the property on 257 Biltmore Avenue, that in return for keeping the same $2.3 million that we provided to them back 5 years ago, for 10,000 patients, we increased the contract 2 years ago. We didn't increase the contract, we modified the contract to allow them to take over some more space in that building. In return for that, they agreed to serve an additional 3,000 patients for the same amount of money. With this latest addendum that we made, we postponed the time that they have to exercise or not their option to purchase that building or start paying rent by 2 years. In return for that, they agreed to serve an additional 3,000 patients. So for $2.3 million, they're now agreeing to serve 16,000 patients. Had we collected the rent or paid for that under the contract, we would have saved, we've saved almost $750,000. So it's a very good, been a very good return, plus gets additional health care services for the under and uninsured.
And those 3,000 are targeted on.
Yes, thank you.
Feel free to cover it. An issue that came up when commissioners met with mission leadership around discharge planning. The inability to access an appointment with somebody discharges from either inpatient physical care or, in this instance, psychiatric inpatient, and doesn't have a primary care home. So it's focused on meeting that unmet need around discharge. I think we made it a little broader to include
All safety net.
all safety net discharges.
And then the famous other category. In that, we have aging services, and if you remember, we contract with Land of Sky Regional Council for the county portion of aging services that the Aging Coordinating Consortium administers. They take our money plus the home and community care block grant funds from the federal government, and they administer those for aging and adult services across the county. And we have a contract that pays Land of Sky $30,000 to administer that contract. Animal services, that represents the animal shelter services that we provide for animals, as well as so we have a shelter, and we also have at Forever Friend Lane, if you've ever been there. And we also have sheltering for horses that we also provide, and that covers all the animal sheltering services that we have. And then there's the behavioral health services. You'll see in a little bit, we have a maintenance of effort with our local management entity, Smoky Mountain. They have a maintenance of effort dollars that we give for the mental health care, plus we put an additional $451,000 in for mental health care. And most of those dollars go towards jail diversion programs to reduce the population for those non-serious, non-violent offenders that are in jail, to be able to get them out of the jail and get them into either meaningful employment or stability so that they don't take up space in the jail. That's been a very successful program and has allowed us to not have to increase jail space nearly as rapidly as we would otherwise. Here's just a graphic interpretation for a visual perspective of what that looks like. The blue representing expenditures, the red, unfortunately, representing revenues. Too bad it's not the other way around. So here's the total Health and Human Services budget, and by this I mean this is what Health and Human Services has responsibility for in issuing benefits, in issuing, administering programs. So DSS by far has the largest amount, and most of that is made up of the addition, besides the 65 million, is Medicaid and food assistance. We administer those programs and we issue the benefits for that, and that totals 397 million. So as we talked about the different areas there are the specifics. So the total impact of Health and Human Services is $418 million, with the county cost, as we showed before, $44.8 million. So let's take a look at DSS in a little bit more detail. So as we look at DSS, you see public assistance, that's the Medicaid and food assistance. You see in some of the foster care that's counted as public assistance is $343 million with a county cost of $4.7 million. Child care subsidy, that's not the administration part, that's paying daycare centers to take care of the children. That child care subsidy administration provides. And you see our county contribution is the $92.5. To administer public assistance is $25 million, and that's a 50-50 split between the federal and the county. With the state doesn't provide any dollars for that, but as we talked about earlier, or before, not in this meeting, but one of the things that the state did do was take over the county's share of Medicaid costs several years ago, and that's been a very good thing. Very good thing. Adult services, child welfare services, look at this. You're going to see some great, unfortunately not good slides, but some great depictions of what that has meant, what that really means to the county in just a minute. Adult services, you'll see, so mostly county dollars in there. And Work First, all county dollars. Other revenue, that's revenue that we get for either billing for services, like for our at-risk case management services that we have. That covers some additional revenues that we get from contracts that we provide in the community, and that totals $4.3 million. So the total request for the to the county for FY15 for DSS is $29.7 million with an impact of $397 million. Again, graphically, you see that of that $397 million, 70% of that is federal, state is 23, and county is 7. We shared this with staff before coming here, and as I said to them, I remember when I started doing budget, the county share percentage was about 4.5%, 5% if it was really bad. And it's now 7%. You think, well, that's just a little couple percent. When you're talking a $417 million budget, that's a lot of money. And you're going to see that here in just a minute. It's a great, interesting slide to look at. We went back to FY12 and said, okay, well, what's that looking like in terms of how the funding goes? Well, in FY12, 39% of the DSS budget was county dollars, 10% was state, and 52% was federal government. Over the years, you see a creep of 46% county and 46% federal from 52. And the state has remained, has gone down actually, and remained steady over the past 2 years. Now, I don't want to mislead you, because you can do percentages and you think, well, maybe that if you look at actual dollars, that's where it is. You're just throwing percentages at us. Well, I'm sorry to have to refer to my notes. I just can't keep that in my head. So that translates into dollars here. It's about $21.4 million in FY12. Well, 29.7 as you saw earlier. Here it was 28.8 It's now 30.2. This represents a 39% increase. This represents a 4.7% increase. It's really not equal. Now remember, we've worked diligently to make sure that we only provide those services that are mandated by law, policy, and statute. Anything that we can contract and not provide, we've done. In fact, we look back from this same period of time in what we call our HISPE doc, and by either savings, leveraging, increased revenues, or by repurposing, we have brought about $29.8 million. So had we not done that, these numbers would have been far greater. Now, here's another slide that's actually even more telling about the reality of what happens when I talked about block grant funding and TANF funding not changing since 1996. Let's look at child welfare, who's almost, there is no, other than 4E, which was drastically cut, there is no uncapped allocation. So in other words, there is no money that just says, doesn't matter, if the people that you're serving and how much that costs will give you money. There's none of that except 4E, and that's shrunk tremendously. So now, don't want to go off this one. In FY12, the county portion of the DSS of funding for child welfare was 52%. In FY15, it's 70%. In FY12, the federal government provided 45% of the funding. In FY15, 28%. Now, if you're adding, this does total to 101, but that's because of rounding. We look at our partners at the state, you see the investment where they supervise our program, and they have the responsibility to make sure we're following the law and policy and statute. Their contribution has remained unchanged.
Before you move off that slide, just to go back to Commissioner King's point, understanding the feds and state are telling you you have to deliver these services. Right. And in child welfare, not only you have to deliver them, what the qualifications are of the staff who have to deliver them, what the caseload size is, what the supervisory ratio is, the timelines for response, and look at that trending.
Now, I want that slide, or I want that, one before that.
It's getting to be very evident that state and feds are having all kinds of mandates to not provide the money.
And you have to argue with them about things like contracts when they're not carrying part of the financial burden.
So again, just to make sure that it's not that we're just increasing our money and everything staying the same, the federal contribution over this time has decreased 27%. And the county portion has increased 59%. Huge, huge numbers. So let's look at public health. Public health total is about $14.5 million, and you see the general areas of how we break that out. Administration, population health, which is health education and promotion, and our WIC services. Clinical services, which is pretty self-explanatory, that's our clinic and running our clinic. Environmental health, that's our food and lodging and our well and septic permitting. And our school nursing program. Of all of these services, school nursing is one that is very much a commission directive and very much a passion of this county for many, many years for the commissioners, as well as our partners in the schools and our partnership through Mission Health. The state contributes $150,000 towards this to support of 3 school nurses, I believe, 3. So we have now how many? 22, 21, 24. Wow, 24 school nurses in Buncombe County, for a total county contribution of requesting of about $8.7 million. If you look at the public health funding overall, you see where DSS is mostly blue, showing federal, this is mostly green showing county. Now, that's been a deliberate decision, because that means that we're only providing those services that public health is mandated to provide or to assure if no one else is there to do that. Now, I say that's deliberate, but the reality is that's because there isn't money to support the mandates that are on us based from the federal and the state government. So if we look at their funding, we see that we're starting out 56% county in 12 to 60% in 15. But we did see an increase in federal funding from 17 to 21. This 18% from sales and service is really billings to Medicaid, Medicare, private health insurance, and self-pay. This is when we were providing prenatal care services and we were billing Medicaid and Medicare. We now contract that service out to Western North Carolina Community Health. So, percentage-wise, the county share has actually only gone up 4.5%. The federal share has actually increased by about 15%. Now, again, that's in real dollars. So, the total impact of Health and Human Services, $418 million, a county contribution of $45 million, and total leverage dollars of $373 million. What that translates into is that each county dollar leverages $9.30 in non-county dollars. Now, that's a very broad look at the Health and Human Services budget. But we wanted to talk and have a discussion with you about something that we're particularly excited about in terms of implementing our core services from an integrated perspective and being able to address some key areas that not only impact families from a public assistance, but from a health perspective and from a social work perspective. So this map, just to look at, shows you is shaded by percentages of poverty. So the easiest way for me to think about it is the darker the area, the higher the concentration of poverty. And this is by census tract. So it's by the individual census tract. So the darkest areas you see are in the center, along this corridor, in the south, and more but less than the darkest are in the far west and the north and this middle corridor. So please, anybody feel free to jump in here in this discussion. I hope this will be a great discussion of what we're wanting to do. So several weeks ago now, we had a presentation from ABCCM. Came and met with Mandy and discussed about an evidence-based program that's done nationally called the Circles Project. And in that Circles Project, it works with families to look at transitioning them or building a bridge to help them become successful and self-sufficient. The way that ABCCM was promoting that to us was to say, let's target some specific areas where there is the greatest need in poverty and target those areas and try to provide assistance. Now, in doing that, they said they wanted to work with Asheville Housing to focus on some public housing areas where in that general area there are highest levels of poverty. And they were saying to us, we want to look at the public housing as more of a transition stop for people to get to a different place, and to view that housing as more of a shelter type system to get them out and get them to build the bridge to success. They said they could have multiple volunteers and be able to provide the assistance to help people one-on-one work through the difficulties that poverty has brought and helped to enhance in their situation. It's actually a very exciting prospect. This has worked in numerous places across the country in helping to get people in a much more successful and stable environment for themselves and for their families. In addition to that, we have had community navigators that have worked in the Shiloh area, Swannanoa, Black Mountain, and Barnersville now, in working to help link those the citizens in those communities. And those aren't our employees; they're actually work for organizations there in that community who know the people that live in that community to help link them better to services in our community. And one of the things that we've talked about is people, especially in the Swannanoa Black Mountain, we believe, and based on some studies that we had done in that area, they don't come actively to seek our services, but if they have someone in their community that they can relate to and that they can deliver services for them, they're more likely to access services. We've seen that in our own work with Rashida and Keenan, who have worked with people in Pisgah View in particular in helping folks be able to take the stigma away from social services and be willing to engage in conversations that don't necessarily involve Health and Human Services at this point, but helps get them services and look to us as a resource rather than as an enemy for involuntary services. So this fits well in looking at what a framework. So we went back and we said, okay, well, what does that really look like in terms of who we're serving?
Can we just say for a minute,
Yeah.
those projects are not decided, those sites. Those were the proposal. Asheville Housing, who we met with, proposed some other options, and we're meeting and follow up to decide it. We'll show you some data in a minute. But also to say, we came back and said, if this is an evidence-based model that works, then we need to provide it in the county as well. So this adds navigators in the south and the west to provide those same levels of supports in each area.
Thank you. So we wanted to go back and look and see, get data. We believe that that's where our concentration is of people that we serve, but we wanted to prove that. So we went back and looked, and we ran numbers, and I'm sorry that this is small, but we'll make sure that you have this information. So first off is we went and mapped all of the food and nutrition services, all of the food assistance recipients in Buncombe County by their address of where they live. And so if we just think back, this is the proposed area, and these are our navigator proposed sites. We went and looked and said, okay, what's the concentration? Well, of the census tracts that we're working on, this is not just specific to the housing areas, but this is to the census tracts where they are. 4.71% of the population is within those census tract areas. But for food and nutrition, 11.1% of the total recipients in Buncombe County live within that census tract. So we said, well, let's look at WIC. Very similar. 4.71% of the population, that's a constant. But 9.1% of the total recipients in WIC are in that census tract area. What about Medicaid? Again, 4.7, 9.43% of the Medicaid recipients are in that census tract area. Well, let's add Nurse Family Partnership. So those folks as well. 9.7% of the people we serve in Nurse Family Partnership are in that census tract area. Let's look at CPS reports. Again, 4.71, but 12.53% of the CPS reports that we receive are within these census tract areas. Here's where, going back to the very beginning, and we said the impact of domestic violence. So that's not a core service that we area that we serve, but the impact, we put that on with CPS reports with domestic violence. Again, that same 4.71, but the percentage of CPS reports with domestic violence involved is 11.25% of the total ones in this area. So when
If
we,
you go back, we also added 911 calls
Oh, yeah,
specific
thank
to
you.
domestic violence.
Yes.
Is also on there. Again, looking at, can we take services and integrated services in partnership with these nonprofit and Asheville Housing or other government entities, drill them down in those neighborhoods to look at health disparities and how we might impact those, economic stability. A big component of this proposal is job training and work, moving people into work. Circles has some very positive data about how they've increased income for individuals served in their programs. So it's really focused on moving people to self-sufficiency. Commissioners identified in their fall retreat poverty mitigation, helping young people get trained and move into work. So that's really a lot of what we're looking at. But also the opportunity to impact the other commissioner identified goal around safety of families and children, the domestic violence component of that.
Jim, and those categories are not discrete, are they? There must be some families who fall into all
yes,
four
they
of
do.
those.
They
So
absolutely do.
the impact would be far greater if we could target those people because they have the greatest need across various programs.
So this is just a more detailed view of those census tract areas to show you. Our HISPs, planner evaluators, they love data, so they got some additional information here that I thought was really interesting. The number of CPS investigation reports, they are almost 3 times as more likely to have a CPS report in these census tract areas than they are in the non-census tract plotted areas. They're about 2.5 times as likely to have a CPS domestic violence report in the census tract areas as in the non. Same with food, almost double with Medicaid, WIC, and Nurse Family Partnership. So from a standpoint of how do we impact the people that we serve in providing the core services and help transition people in building bridges to help make them more self-sufficient and more able to manage the trials that we all have within a family, by focusing our resources on this in partnership with a strong network that has a strong network of volunteers to be able to do that in an evidence-based model, we believe not only helps save resources for us, but also strengthens those families and helps make them able to have a generational change within their family and within the lives of the people that come after them.
So Jim, do you feel that ABCCM has already somewhat spoken with these people in these proposed communities to say this is what we're interested in doing and have gotten their feedback rather than doing the missionary approach of we've come to save you?
I think that's a great point. The whole purpose is meeting with Asheville Housing and making sure that Asheville Housing is, first, aware and is agreeing to that. Asheville Housing is actually changing some of their models in terms of the way they look at housing as a result of changes at the federal level in terms of how they get money to operate their programs. They're transitioning those programs to a more Section 8 type environment so that they can continue to draw down the money to support those, because the money for public housing is actually shrinking, is going away. But you're absolutely right. It can't be, or whether it's faith-based or I'm from the government and I'm here to help type approach. That's one of the things that we've seen has worked extremely well by having the navigators that have worked in the communities, by having Rashida, by having her team, by having Keenan actually work in the communities and find people that live there that we can establish relationships with, and then have those people be able to say, here's what a Health and Human Services can help you with. Here's what I've found as a resource to be able to help me. Let me tell you about it from my perspective to be able to involve you. And if you choose to involve yourself, great. If you choose not to, that's fine too.
Yeah, and I think that's the difference, because if you look historically, that was the approach Tuskegee used years ago. You know, just get that by, we've come to do this, and
Well, we sell that with public health
there was
too.
no buy-in, you know, from the
Yeah.
people, but
Right.
giving them that option, because when you start looking at these communities, this is generational. This goes way deep, you know, about their mindset, and you know, so it's gonna take some more.
Jim,
It's
I've been on
education
their
and trust.
advisory committee for the Circles program, and I think it's a very good program. So far, they've taken volunteers, people who wanted to be in it, and have been very successful with matching them with mentors who help them through a lot of the struggles of day-to-day living and making decisions and all kinds of things that are useful. I understand your concern about them targeting the housing, but I think if that's where the people are who have all of these multiple needs, then I think that's a good place to go. But I don't.
Yeah, and I do too. My interest is to make sure the people
Want it.
understand, and that they have that level of trust has been built, rather than we know what you need and we're gonna fix it, because it may not actually be their concern or their priority.
I think when Scott sent the proposal in, that's why we said, okay, we want to meet with Asheville Housing and we want to meet with Early Head Start. And we're saying to you, this can't be just about circles here. This has to be about a coordinated, integrated poverty mitigation approach all over the county, which is why we're saying we would take the same model and partner in each of those areas of the county, whether Circles did that or not. They're going to have to be brought in that. You make a good point. In response to meeting with Asheville Housing, they scheduled community listening sessions at the projects, and did one of those happen last week, Thursday? Do you know, Philip? I think Thursday was the first one, to ask people just that.
Good.
How do you feel about this?
Good.
One of the partners is Early Head Start, Head Start, who's looking to apply for Early Head Start dollars connected to this, which would basically be able, between Early and Head Start, to provide 5 years of quality child care to those kids before they enter school. But one of the things Asheville Housing shared with us is that they see families choosing not to participate in a Head Start. So a part of the process is trying to understand why. What is that about Head Start that doesn't work for you? Is it the hours? Is it the work requirements? To see why those services aren't being used.
That's certainly a massive look at what Health and Human Services is all about. And it's just mind-boggling. She's made whisper to me, it's mind-boggling. It really is. It's the service that we provide, and that is really what county government is about, serving the people. And any way we can come up with a situation where we can do a better job of what we already do, I think is a wonderful thing, and I'm sure we're going to hear a lot about this in the future. And, thank you for bringing that to our attention. Now, Jim, I have a question.
Yes.
You started out with a budget. You indicated that there was a budget that you wanted the county commissioners that we would send to the county commissioners and endorse. You want to endorse that part or the full thing that you reported?
I think that's the pleasure of the board, but in terms of presenting the numbers, we're presenting to you the budget that we have submitted for FY 2015. And so whatever the pleasure of the board is in terms of endorsing
So
that.
the one incident where it's just what the county gets involved with, what they're going to, the
You
commissioners.
want to bring that slide
Yeah.
up?
That will be incorporated in anything that we endorse. Is that what you're saying?
This budget.
Yeah.
Okay. All right. I have motion that we have an endorsement to the county commissioners, including all of the various things that we added to it. I think we added 2 resolutions or endorsements to it. Do I hear a motion that we send that endorsement to the commissioners that we really do support this particular budget?
I'll move.
Move, do I have a second? Second. Candace, you said before he did. Any questions or anything?
I do. Jim, I know this is slightly, it's somewhat higher than last year's. How much more is it?
Yes, that's. I can tell you that the mental health is the same, the LME is the same, aging is the same, animal services is the same, Valley Child Care is actually a reduction. The DSS portion of the budget is an increase of 12.3%, or $3,285,000.
So what's the overall percentage then? It's not that.
Is that just the county or is that the total?
That's the county. That's the county share. Commissioner King, I'll have to go back and get that to you, just tell you the exact percentage increase.
I want to say, what did around 39 and some change last
Well,
year?
I can tell you that the DSS budget increased 3.3 million. The health budget was 248,000, so it was about 41 million last year. So that's.
All right, just submit it, bring these slides with you.
I'll make sure that that information.
Well, we need this backup for it.
Any further questions? Hearing none, all those in favor say aye.
Aye.
All opposed, approved, same sign.
Krista needs to know that Commissioner King abstains.
Okay.
Yes. And we're glad to see Commissioner Belcher.
We could have put a blood pressure cuff on you before.
No, blood pressure's not a problem. Cholesterol.
Stay healthy.
Well, we can get you medicines for that too.
Okay, thank you. Yes, very much. Thank you. Now we have Mandy, you and Kitty, I think.
That's right. In terms of director's report, several public health related updates that Kitty's gonna give to us. Seems to be a happening place today.
Yeah, there's been a few things going on lately, and just wanted to update you on a few things. You have at your desk a report that looks like this. It's called it's our monthly morbidity summary. You're gonna start getting this in your packet every month, but because you hadn't seen it before, we wanted to take just a minute to just tell you what's on this piece of paper, so it's not confusing to you. And I'll let you know right off, we're having some issues with a few of the numbers because of the way they're being reported now. This report is specifically around those diseases that are reportable in the state of North Carolina. So these are the diseases that public health, doctor's offices, hospitals, pharmacies, laboratories have to report to the state government. A lot of those reports come through our office and have to be signed off on before they get sent to the state. But we're starting to see some electronic reporting, so now we're starting to see some things go straight to the regional office and then to the state, or straight to the state. So it messes with our numbers sometimes. We're trying to work that out with them, but the majority of these are accurate. The AIDS numbers and the syphilis numbers are the ones that we're having the most problem with right now, so don't pay a lot of attention to those when you review this report. But what you see are, these are the reportable diseases in North Carolina, and they're broken down in a couple of different categories. The first being vaccine preventable diseases, the food and waterborne diseases, sexually transmitted diseases, other types of transmission, vector-borne diseases, as well as the biological agents. And hopefully you'll never see anything in the biological agent list. I'm hoping for zeros always in that category. It shows you for 2014 the month that we're reporting and the year-to-date totals, and it also gives you the 2013 numbers to be able to compare with. So the last column is the the total numbers for the year for 2013, just to give you an idea of what we've experienced in those categories. So we're just the second, into the second month of the year. You'll notice as you go through this from month to month that there are certain times when we have different diseases that spike. So flu, you'll expect in the fall into the winter, and then a little bit in the early part of the year. Other diseases, some of the ones that we see more in the summertime. So you'll notice that as you go through. The back of this and the next page are the same diseases, but they're in alphabetical order, and it just gives you some trending information over on the right-hand side of the paper. So the bar graphs. So it just gives you another look at this. So we'll be providing this to you monthly. If you ever have any questions about it, please let me know. We won't discuss it every month. Yes, sir.
I just want to make sure I understand it. This is a calendar year reporting. So
This is calendar year reporting, yes.
Not fiscal year. Okay, if I look at this, there were two deaths. I just want to make sure I'm reading this accurately. There were 2 adult deaths by flu in January.
Yes.
Okay. Now you have on months, there's a 1 for there, but there's nothing reported in any other category. So that should have been a 1 in year-to-date, shouldn't it?
It should have been a 1 in year-to-date in
Yeah, okay.
2013.
I just wanna make sure.
As I'm telling, this is a new format for us, and what we've discovered is that we've got some issues with the spreadsheet that was developed. We'll get those straightened out for you. The main reason for you to look at it this month is just to see the formatting, so you'll know what you're looking at next month.
It's required reporting.
It is required reporting to the board. So,
And could you,
yeah, that was an odd one for us. We come up with some interesting stuff right now. Right now, we have
There's another one that doesn't make sense. to
which
me.
one?
Whooping cough at the bottom of that list.
The pertussis?
Yeah.
Yeah.
Yes.
19
Yeah.
for 2013, but only 6 in that category.
That, it's the way the spreadsheet has been developed, and we'll get those kinks worked out for you next month. Hopefully, we'll get them worked out for you in the next couple of days, and we'll send you the updated version with the correct numbers on it. How's
When
that?
it say quit being picky.
No, that's fine. I did want to point that out to you. The
He's
numbers
just
on
being-
this page aren't totally accurate, so, and it's again, the AIDS cases and the STD cases are gonna take us longer the syphilis cases are gonna take us a little bit longer to work out, because we're having to negotiate with the state. And sometimes that takes a while. So that's this document. Hopefully, you saw the email that I sent to you about the county health rankings that came out on Wednesday. If you'll remember, this is the 4th year that we've had the county health rankings. Buncombe has ranked for the health outcomes, which is morbidity and mortality stats that really shows us what the health of our community is right now. We've ranked in the top 20 in the state from the beginning. When you look at the health factors, which are the things that tell us what our potential future looks like, we do much better. This year we ranked 7th, last year was 8th, so we've got some improvement there. There's some new factors that were added to this, some new measures that give it more of a health and human services perspective than we've seen in the past. So if you have more questions about any of the factors that were involved and engaged, we try to give you enough information, but not too much. There's also the County Health Rankings website that gives you a whole lot more information if you want it. The one that always gets people is I don't have the graph, the map to show you, but the one about air quality. If you look at the map for North Carolina around air quality, you'll see that all of the counties that have the poorest air quality are in the western part of the state. And as you move across the state, air quality improves all the way to the coast. So we are benefiting from air quality that's coming east, out of
Creeping Tennessee.
and there you go. So there are some interesting maps on that website if you have an interest in more of that. This is good data. This is one of our data sets that we look at. But we also produce a state of the county health report every year. It's also required by the state, and it's tied to our community health assessment. And that is our local data that we pull. There's a lot more data in here. We will send you a link to this document as well. That is a yearly report that we provide to the state, but also to the community as a whole. It will be on our website, but we'll send a link to you so that you can access that report. And I'll be happy to answer questions about either one of those reports as you have a look at those. The other thing I wanted to talk to you briefly about is we've had some environmental health issues recently. You may have seen some things either on the news or in the newspaper. Most of these have been related to either groundwater or rivers and streams in Buncombe County. So I wanted to take just a minute to help you understand who all works on those issues from the federal government down and what the county's specific roles are about that. Some of the issues we've dealt with, we've had a reporter who's been very interested in complaints around well and septic issues. We've had a riverkeeper who's been doing some testing of the water in the South French Broad, and we've also had concerns around the Coal Ash ponds in the southern part of the county. Commissioner Belcher actually got an email from a constituent down there who had had some, her homeowners association had done some soil testing. Their housing backs right up to the coal ash ponds. And there was concern about high levels of, she said Valium, but she meant thallium. And we were wondering what the problem was, that there were high levels of valuable soil, probably really happy plants, no stress, but high levels of thallium. And so those are just a couple of the issues that we've been dealing with. The reality is our role in some of those things is very limited. The only water that we are responsible for is water that we permit and or test. And that's basically wells and swimming pools. The South French Broad, there's no one who's assigned to test that on any kind of real regular basis. The rivers and streams, the same thing. Unfortunately, the reality is anybody who cares to fish, swim, wade, or have any other kind of contact with free-flowing water that is not treated on a regular basis is doing it at their own risk, because you never know what's in that water. The riverkeeper tests infrequently, and on any given day, if we've had a lot of rain, runoff from surrounding streams or from the ground around the river can produce high fecal coliform levels. And those levels could go down 6 hours later. So it's very difficult to monitor those in a way that could inform people that you should not swim in this body of water right now. We have the EPA, who has main oversight over these sorts of issues, usually don't get involved unless there are some major issues like out of the CTS plant with the groundwater out there. We have the Division of Environment and Natural Resources, who has some responsibility and does some testing through their Division of Water Quality, but they're more focused on overall water quality. They're not just focused on what disease or what kind of issues there might be that could be of impact to humans. They're more concerned about general water quality. Then we have the Division of Public Health at the state, who has staff who's concerned about the impact of people's health in relation to water. So we've got DENR working on some things, we've got DPH working on other things. They don't always talk to each other. Actually, they don't like to talk to each other around some of these issues. And then we have the local public health department, whose job it is to try to keep the community informed around some of these issues and to manage those things that we control, again, swimming pools and wells and septic tanks. We have been involved with the state and with EPA in conversations around all of these issues, but again, we have limited responsibility for them. So we try to keep the community informed when we understand that there's a problem. We're continuing to work with the regional office of the Division of Water Quality to make sure that we get information from them on the testing that they're doing so we can at least have some idea of what might be going on. But again, our responsibility and our authority is quite limited. So I wanted to make y'all aware of those things. You'll see some things in the paper from time to time that question why we aren't doing things. Part of it is because we don't have the authority to do some of those things. Part of it is because it's not our responsibility and there's another entity that should be working on those things. So any questions about that? Or comments? Anybody?
Thank you.
Thank you. You have any other
I
follow-up?
know, thought that was enough.
That's
Do we have any public? But I don't see, no one signed up yet. Okay, I don't have any report either, therefore, do I have a motion that we adjourn?
Before you do, Mr. Chair, I'd just like to point out one thing. The county has been involved with a diversity project that I think is doing very well in its effort, and I would like to commend the departments for their support of that effort, and especially to call out Frank, who is a member of our board here, who was highlighted in the Urban News recently as an example of someone who mentors folks and brings them on board, and I think that's a very good practice that we just ought to have a recognition of from this body.
Thank you. Congratulations to you, Frank.
It really is Lisa Eby who stepped away. I mean, this was her brainchild to do a lot of this work, and it's amazing to bring together, it's about 15,000 people that we're looking at in terms of a workforce and really focusing on advancing minorities. You know, what do we do with our workforce? What do we have? And leveraging all of our resources together and working towards that goal. So I'm passing it towards Lisa, who's not here at the moment, but yeah, please acknowledge her.
It's
when
been a
you see
great
her.
model. You and the Center for Diversity and Education, a big driver of that, but all the anchor institutions sharing resources, and thanks to Lisa, in the next year, they're all gonna contribute
Sorry, we're dealing with
money
the.
equally around those diversity efforts. So both school systems,
Yes.
help me if I forget anybody, AD Tech, UNCA, the county, the city, Mission, and Mayhack. Is that it?
AD Tech, Mission, University of North Carolina at Asheville, and city, the county.
So it really
And
is
the
about the
chamber.
anchor institutions saying we ought to be the model. And we ought to help provide resources to other smaller employers. So this has done a great job with it.
It's actually very, very exciting. I'd love to give you more information about it. It's a very, very exciting thing that we're doing. So. Well, Frank, you can speak up to that.
We did.
Sorry, I've been dealing with a little crisis in the hallway that's going on with my
Thanks to all
employee.
those that are working with that, and Frank, I'm glad to know that somebody recognizes what you do. I think it's real nice. It's wonderful.
Very involved in the consumer advisory.
Yeah. Now do I have a
So move.
move, second, to adjourn? Second. All those in favor, you may leave.
Aye.